This is Nursing Uncensored. I'm your host, Adrianne Benning, and I invite you to listen in on conversations I've had with real nurses about the crazy and wonderful lives we lead. This podcast is meant to create laughter in addition to serious discussion, and nothing is off limits. We're always honest, but we're not always safe for work. Please listen responsibly. Welcome to Nursing Uncensored. Today, I am pleased to bring you Dr. Iman Abuzeid, CEO and founder of Incredible Health, which actually we're going to talk a bit about, as well as lots of other things. So welcome, Dr. Abuzeid. Am I saying your name correctly?
Yeah, you can just call me Iman.
Okay, Iman, great. Thank you for joining us today. This is fantastic that you made time to talk to my audience.
Yeah, thank you for having me. I
Yeah.
love talking to nurses.
Yeah, this is great. This is a perfect time as well because there's just so much happening in the world of healthcare, specifically nursing. I know that nurses are currently relocating all over the country to meet the needs that that hospitals have to fill their staffing, to fill their empty holes. Now, your company, I would love it if you would both talk to us about a little bit about Incredible Health, what the
Yeah,
company is, your role, as well as a little bit about yourself. I'd love to hear more.
yeah, that sounds great. I'll start with myself. So my name's Iman Abuzeid. I'm an MD by background. I actually don't practice at all anymore. I've worked in hospital operations and strategy, and I've led products at healthcare technology companies before starting Incredible Health. Now, the reason I started this company is a lot of my family members and friends are doctors and surgeons, and they were often complaining about understaffing,
Hmm.
especially the understaffing of nurses. And like you don't necessarily want your OR to be understaffed. You don't want to always leave your patients with contract workers or travel nurses all the time, right? So there was definitely some friction there. And at the same time, my co-founder, who's a software engineer from MIT, his name is Rome Portlock, his sisters are all nurses. And they were saying it takes at least 3 months to get my next job. I'm experienced, I'm qualified. I submit my application to 10, 15 places, and I usually never even hear back. This is probably something you've heard as well.
Yes, absolutely. And I also know a lot of nurses that are travelers
Yeah,
and they are ready to go now. And the lag between the time they decide they want to go and the time they actually land in that role, it's a lot of time, time that they could be actually utilizing in those roles.
exactly. So whether you're looking for a permanent job or even a contract job, it's just very
Hmm.
it's very difficult and very frustrating, honestly, for nurses. So,
Absolutely.
so we figured there just has to be a better way. And so we came up with this crazy concept of that is Incredible Health. And so what Incredible Health is, it's a career marketplace for healthcare workers. We're focused on nurses right now, RNs, NPs. And what we do is hospitals and health systems, they use our platform to hire nurses in permanent roles in less than 30 days. It normally takes 90 days or longer because of this inefficiency that we were talking about earlier, and the fact that we are in the midst of a massive nursing shortage, where in just a few years, we're going to be 1 million nurses short because our
Yes.
demand for healthcare keeps going up.
And we feel that. That feels very real at the bedside when you're running short, you're pulling nurses that don't normally work in your area from other areas. And it really does have an effect on patient care, really what their outcomes are. And so this is definitely something when I first heard about Incredible Health and what you folks are doing, I was actually really excited by that because, well, I'll let you finish. This is a great concept, and I think it really does make it easy for everyone involved.
It does, yeah. So there's probably three things that make it unique and why nurses love it. The first is that the employers apply to the nurses instead of the other way around.
Hmm.
So it really gives nurses what they deserve, which is the upper hand and control.
Hmm. Absolutely.
Right?
Yeah.
And so the way that works is a nurse creates a profile and she or he just sits back and relaxes, and they're going to get an interview request from Stanford Healthcare, from Cedar Sinai, from University of Iowa, from wherever, right? Depending on their preferences. The second thing we've done is that we've automatically been able to screen nurses using our software. So we've integrated with all these databases so we can automatically verify things like licenses and malpractice records and certifications and so on. So that speeds up the process as well.
Mm,
And then the third thing we do is we built these custom matching algorithms for each of our employer clients. So what that means is that when, let's say you're a recruiter at, say, HCA, and you log in, you don't want to see 200 nurses. You want to see 14 that are the right fit for you at that time, that are relevant for your location, your specialties, and all the different things that you're looking for. Same thing on the nurse side. The nurses don't want to hear from 200 employers. You want to hear from 4 that are the right fit for you. And so that's what our matching algorithms enable. So the
right.
end result of all of that is, and all that software and all that operational work is, you get hired in less than 30 days. The average on our platform is that you get a 17% increase in your salary. The other average on our platform is you get a 15% reduction in your commute time too. And so, yeah, that's what we're here for.
And really, and this isn't a too good to be true situation. Like, this is an actual thing that you're doing. It is working. People
Yes.
like it. I've actually,
Hundreds of nurses have been hired on the platform.
yeah.
And you can
And
see the reviews from nurses on our Facebook and Google pages too.
and I recently signed up. Even though I'm not currently looking for employment, I wanted to see
Yeah.
what it was like. And the sign up was incredibly easy. I was able to upload my resume and create a profile in just a few minutes. And at the risk of sounding like an ad, it was much easier than I expected it to be. And the very nice thing about it is when you open up the app, the very first thing you see is like there's an inbox of offers that you can actually look through. So once you've established a profile and you've gone through the process, nurses they are being shopped for. The
Yeah.
competition is on their side rather than ours. So that's really nice because in addition to what you were describing in that you don't want a hiring manager to have like an overwhelming number of applicants, some of which may not be appropriate. But also, if I'm getting a call back about a job, or an email about a job, I want to know that I'm not one of 200 applicants,
Exactly.
um, because it's a lot of energy. Maybe not with this situation, but it's a lot of energy to apply for jobs and
It
think about
is.
where you want to go and what you want your future to be and what you want your career to be like. And
It is.
so,
And it's hard to do while you're working too. I mean, the majority of nurses on our platform are already working while looking for a
mhm.
different job. So
Yeah, and this, I also understand that there are some nurses that I know that work within, like, they'll find these larger health systems that work through your profile, and then they can find jobs in a number of different places. So they're not just limited to, because you're in San Francisco, is that right?
yeah, we're based in San Francisco, but we have a presence in 5 different states:
Mm-hmm. Mm-hmm.
California, Texas, Florida, Illinois. And what that means, so we have like 3 different groups of nurses. We have one group that is relocating from a different state, and that's a third of the nurses on our platform.
Mm-hmm.
We have another third that is just looking for a different job in their current city. And then we have a third that is moving around within their state.
Mm-hmm.
So it's really, we track all the different reasons nurses change jobs. And of course, you can imagine there's so many reasons, but the top reasons are more pay, I need to relocate, I need to reduce my commute time, and I want to advance my career.
Absolutely. All of those, I completely agree. Personally, I find those to be true. So this is actually a really unique way to go about it. Incredible Health really is a fantastic program, and you guys are doing other things as well. We all know that with the current situation with this global pandemic, that you guys are also helping nurses. What is it? Let me make sure I get this correct. That you're helping nurses relicense, nurses that have either had their license expire or need to renew their licensure. And you guys have a hand in that as well. Is that correct?
That's right. So the mission of our company is to help healthcare professionals live better lives. And that's really what we're focused on. So, Incredible Health is not just the place where you find a job, it's the place where you manage your career. And so one of the exciting things we announced just a couple of weeks ago, which honestly tens of thousands of nurses have already taken advantage of, is a first of its kind platform for continuing education units. that are
Mhm.
completely free for every nurse in America. Usually, CEUs or continuing education units are things that nurses pay for, often out of pocket. We calculated it actually over $240 million
Mhm.
is spent annually by nurses every single year just on continuing education. And now we wipe that out and we're like, it's now free. And so
And
they
what
can hundreds of online courses. And the reason that matters is because you need your continuing education
Mhm.
units to renew your licenses, to make licenses that are inactive active again. So this is part of compliance as well.
And that actually was a huge draw for me. I almost didn't believe I thought, "Oh, maybe they'll have a small selection of free." They really are free ECEUs, and with that being said, I personally would love to take advantage of this.
Sure.
This is great. I mean, everything it's an alphabetical listing of all of these topics, and there's something literally for everybody.
There is also a COVID-19
Mhm,
course for those that
mhm,
are interested in that too.
absolutely.
Yeah, we accelerated the launch of this because of the pandemic as well. Like, I
Mm,
mean, it was always in the works, but we just accelerated it because of the pandemic, because we knew that there was going to be even more movement in the labor market, and nurses would need to even more rapidly renew licenses, or those that are retired and have inactive licenses want to come back and become active again. So we knew there was going to be all these changes, and we wanted to make it as seamless as possible.
and have you seen a large number of nurses that are utilizing the service already? I mean, it's just launched, but I'm sure
Just
that there's interest.
Yeah, it's very strong interest. Within less than 10 days, we had 10,000 signups. So
I would expect nothing less. This
yeah,
because nurses spend a lot of money on CEUs. I know that there are some people that will do their CEUs throughout the course of the 2 or 3 years, depending on their state, between renewals. And some nurses will spend large lump sums just to do like a conference where they get all of their CEUs done in one fell swoop. And both of those have their financial drawbacks because you are adding up a lot of money for these things. And not only are these CEUs required for licensure, but they really do help us in our practice.
yeah,
This is not just unusable information. Like this is practical, hands-on information that's used at the bedside and in every facet of
yeah,
nursing. So
exactly. So both all of the CEUs, as well as the hiring product, is available in Incredible Health's iOS, Android, and web app. And
mhm.
it's just like you mentioned earlier, it's just a seamless sign up process at Incredible.
Yeah. And honestly, I am more likely as my career goes on, I'm a nurse. I'm almost reaching my 4-year mark.
Yeah,
And while I love where I am and I don't have any intention to leave, I'm still very curious about what else is available. Illinois is a bordering state. I grew up in Illinois. And
yeah,
so I have to say, I was really interested to see that you guys have lots of locations around the state of Illinois. I'm not familiar with the other states that you guys have a presence in, but it's just nice to know that I have something that I can easily access on my phone. I can scroll. Um, it
exactly.
it
Yeah,
was so easy. Like I sound like a broken record, but it was just so easy. I can't stress that enough. As
yeah,
someone,
and that's our goal.
yeah,
It needs to be
when you're
seamless for nurses. Yeah.
12-hour shifts, families, all of these things,
Yeah, to
they
give you a sense of like the type of employers that we work with, we work with large academic medical centers like Stanford and Cedars-Sinai.
mhm,
We work with very big health systems like HCA, Baylor Scott and White, and then we also work with a lot of community hospitals too. So it's a whole range of employers, and depending on your preferences, how you want to advance your career, different employers are suitable for you.
sure. And for those employers that are listening, they can also sign up with Incredible Health. So they can what I imagine put in criteria for who they want to hire, what candidates they want to seek, and
Well,
then
we
you
make it
guys.
seamless. We make it seamless for them too. So
So it's win-win. Everybody's happy.
on the employer side, the reason they use us is because they have a lot of roles they need to fill, and they are not armed with. They're armed with processes and tools that honestly haven't changed since the 90s.
Hmm.
And that is why many nurses experience this black hole of HR. Like, they are inundated with applicants, but they're
Hmm.
sifting through all of that manually. So the screening and the matching that we do with our software helps them considerably as well. And they are really trying to fill their roles much, much faster, because that's massive cost savings for the hospital as well, because they don't have to spend as much on overtime or on unfilled positions or on travel nurses and so on, right? So they're really urgently trying to fill as well.
And this is something that we are seeing such a fluctuation in trends. One of the things that we're seeing is we're defining things as essential and non-essential, and those non-essential services, elective procedures. I know that our OR and our clinics have dramatically cut back the number of patients they're seeing. And so that means that there are nurses that are looking to shift and employers that are looking to shift around their skilled staff. I know a lot of our staff are cross-training in different departments for these potential surges in different areas. And I know there are other hospitals that are seeking to reinforce their workforce because they do have holes. And so I think it's interesting that I'm sure you're seeing a lot of these trends as
Yeah,
well.
I can share some data with you.
I would love to hear it.
So what we're seeing is an increase in demand for ER and ICU nurses in terms of hiring new ones. But like you mentioned, demand for OR, labor and delivery, some of the units that have lower patient volumes now has dropped. Pretty much every single hospital we work with is doing the redeployment of staff that you just described, where, you know, the OR nurse is getting cross-trained, might need to help in the ICU unit, right, as an example. So those are some of the changes we're already seeing. It's like, you know, we all have to adapt to this situation.
And that's the thing that I think a lot of people don't realize about all of this is that nurses are, not only are we very adaptable professionals, but there's a lot else that goes into figuring out where you're going to work, because you mentioned that you guys do a lot of the data management and streamlining of that. Because I know that when I got hired, it was weeks of, okay, now we need to verify that you graduated, now we need to verify that you got your license, now we need to see if you have ACLS. And so there's something very nice about knowing that you need to switch jobs in a hurry, or you want to help, or you want to move to an area that maybe is struggling a little bit more than the area you're in. And so you don't want to have to go to your Dropbox and find the 15 different documents that you need to send to like 12 different hospitals.
Yeah, exactly.
So are people utilize, I imagine this service is really well received as also.
Yeah, it is. It is.
Make it simple for a nurse.
Yeah, we started our company in 2017, so a couple of years ago. And the expansion and growth has been very rapid. Where we really focus on is the mission of helping healthcare professionals live better lives and helping them find and do their best work. And what that means is that we want to be the company that's out there that's giving nurses just the best experience possible. And a very delightful experience. Because honestly, this is a group of workers that is historically underappreciated, overworked, you know, and I personally don't stand for that, right? And I want to make sure that we are a service, and whether it's a software from the service, the opportunities that we have on our platform, everything is catered towards giving the nurse an amazing experience.
And I do want to highlight this as well, as people realize from your introduction, you're a physician, and there is this stereotypical, I want to say, negative imagery in the public mind of like doctors and nurses being adversarial, but really you're in this because when you're helping nurses, you're helping the entire healthcare team.
Yeah.
And so that puts a lot, when you know that as a physician, when you know that you have a team of nurses caring for your patients that are competent, educated, compassionate, you know that your patients are going to have better outcomes.
Exactly. And the data shows that, right? Like, so
absolutely.
It's like, there's no debate on that. We work in teams. The better the team is working together, the more competent they are, the better the outcomes. And we see that when teams are understaffed, for example, we see patient satisfaction drop, right? When teams are when nursing specifically is understaffed, we see patient mortality go up. We see readmissions go up. We see more medication errors happening. And this is all very well documented and well researched. Staffing and getting the right people is critical to patient care.
And as a nurse, I experience these things on a regular basis. My hospital is not critically short, but we do deploy nurses to other units. Over the course of the last couple decades, we've had travel nurses. And so it's really palpable when you don't have the staff that you need. It doesn't sound like much maybe to folks that aren't in healthcare, but when you are used to having 3 patients and suddenly you have 5 or 6,
Yeah,
I mean, when you do the pure math, you have 12 hours on a shift. And
yeah,
if you have 4 patients, there's just only so many hours to spend. And so having adequate staffing, there's a lot of I just think there's a lot of misunderstanding. The numbers show that mortality increases, but really what that feels like on the unit is that someone's loved one just can't, like, they physically can't get to that person if there's not enough staff. And so it
exactly.
becomes very serious very quickly. And I think that creative solutions to this are necessary to us seeing improvement in outcomes rather than,
Absolutely.
worsening.
Yeah. And interestingly, like we strategically chose to focus on permanent hiring, not,
Hmm.
travel nursing or contract
Hmm.
workers. And that was done very intentionally because it aligned with what the employers want. The employers are just to give a sense of how hospital executives even think about this, right? Because it's important to understand like all the stakeholders here.
Hmm.
Um, they are under a lot of, hospitals run on very thin margins. When they are understaffed, they are often spending more on uh, contract labor.
Hmm.
Contract labor is usually twice as expensive as your permanent labor, and that's eating into the bottom line. Um, Also, there's a lot of data that shows physicians and doctors are not a huge fan of the contract labor either. So it's really, they are under a lot of pressure just from a financially and from a quality of care standpoint to reduce contract labor and increase their permanent labor and make sure that that staffing is adequate.
Right.
Now, sometimes you can't help it; you still have to get the contract labor,
Mhm.
but just to understand just how they think about it in terms of the finances and the quality of care.
But there's a reason that contract labor is short term. There's a reason that permanent staff, and we do, even when we pull nurses from another unit, we're still seeing an increased cost for that. So
Yes.
that's why there is such an incentive to have staff that is sticking around and
Yep.
they know your patient population. And also, the physicians that I've worked with for many years, you get to know them. You get to
Yep.
know kind of how they handle certain situations. They get to trust us as nurses, and so when you do have that permanent staff solution, I think that it creates a better environment for care to occur.
It does. Yeah.
And I think that it's great that there are a lot of travel nursing agencies, but that kind of area is established and there are people there. This is kind of like a new concept. It shouldn't be, because we think about all of the other types of social media where we can seek out, whether it be romantic matches, trades, skills,
Yes.
marketplaces. There are all these, uh, what do I want to say? There are all these venues in which we can connect with each other to receive the services and skills that we need. And so
Yeah.
it just seems like a natural progression of social media. It really is.
Yeah.
It's an app on my phone. It doesn't even feel like I'm applying for jobs. It's just an interesting platform that I can just log into without any effort and cruise. So it's kind of unfortunate that I'm not looking for a job
Yeah,
because this
but
is
one day you're, many of your listeners are. It's interesting that you say that because chief nursing officers, they refer to us as they're like, oh yeah, incredible health. That's the match.com of hospitals and nurses.
yeah, but that's perfect. That's what you want. You don't want to apply for a job knowing nothing about, because really sometimes job descriptions are just not
It's too generic. Yeah.
it's generic. It's like you're reading the nursing process.
Yeah.
You're reading the basic general things that all nurses do, but that doesn't really tell you if that job is a good fit for you. And you
Yeah.
never want to get to a job that you're excited about and find out that it's not what you expected.
Yeah.
So this level of transparency is really, really nice.
Yeah.
Um, I think that staffing trends. I mean, what do you think is going to happen? I know you guys are growing. Healthcare is going through some radical changes right now, unprecedented headlines. But what are some things that you're hopeful about going forward?
Yeah. I think Okay, the shortage of nurses, which has existed for quite some time now, is projected to get worse, right? So by 2024, we'll be 1 million nurses short. The nursing shortage is the biggest skilled labor shortage we have in the country today. And so the reason that's happening is our demand for healthcare keeps going up. Our population is aging. Now we have random pandemics that happen. Like,
Yeah.
this is just like the demand is just really, really continues to increase. But we simply don't have enough workers in the system.
Mhm.
I think that, as we are entering this period that might be a recession, I think we're going to see a lot of fluctuation in demand, actually. So I think the next couple of years is going to be a little bit of an uncertain period for hiring. And I probably have already seen reports of nurses that are getting laid off and getting furloughed and so on.
Mhm.
If this once we do get this pandemic under control, maybe things will stabilize again. But this is a tumultuous time for nurses. I actually we did a survey of our nurse database recently, just specifically related to this pandemic. And I wanted to share a couple of data points there. So one is that 67% of the nurses in our database said that they don't feel that their hospitals have the appropriate personal protective equipment to properly protect them from COVID-19. So 2/3 of nurses are reporting that they just don't feel like it's adequate. And then 64% are also saying that they don't feel adequately supported to deal with the added stress, mental stress of dealing with of COVID-19. So that's like some interesting stats. It kind of, honestly, it didn't surprise me. Right?
Unfortunately not.
Unfortunately. And my hope for the future is we move towards a world where nurses have more of the upper hand, where they are properly taken care of, appreciated, and taken care of. And I think that's where it has to shift, because the shortage keeps getting worse. Like, employers don't have a choice anymore, right?
Right. And without nurses, there's so much from community health, inpatients, even just your doctor's appointment, getting your prescriptions refilled, nurse practitioners. There are so many things that nurses do that if we don't have them, they can't do. And we're already seeing huge health disparities. And so we don't need to make those worse by now having no healthcare providers. And
Exactly.
when people get burned out or they're in a job that doesn't fit them, a lot of people do leave nursing permanently.
Yeah.
And I think I don't know the statistics, but I know that there's a very high percentage of nurses that leave nursing within the first couple of years.
That's right.
And oftentimes, I think I've talked to a lot of nurses, personally anecdotal, but just the same. Lots of nurses say that, well, I thought I had to do this, so I did this and I hated it. I thought I had to work med surg, or I thought I had to work in long-term care first. Like, they have all these expectations, not realizing that all of these opportunities exist, and that
Yeah.
they just need to actually seek them out.
Exactly. I mean, the opportunities, the talent is there.
Hmm.
Opportunities are just hard to find.
Right.
Just,
And if we can create a system where it's the norm that nurses can get into jobs that suit them and that they meet the skill set that's necessary, and they're happy with their employers, and the employers are communicating with the nurses, we win, because happy nurses, I mean, even when I feel healthy, rested, compensated, and appreciated, you have a little skip to your step. And even though I'm speaking with a lot of hyperbole, really, if you feel appreciated and you're in the right job, that can be a really great, empowering thing that positively impacts a lot of patients.
yeah.
And so if we don't see appropriate staffing, we're not going to see new nurses flooding into this.
Yeah. And
Because
it's changing. I mean, we see the attitude of the employers already changing. They know they
it
don't have,
has to, yeah.
yeah, they don't have the upper hand anymore, right? So
Mm-mm.
they care a lot more about things like the candidate experience. Like, what is the nurse's experience while they're getting hired, right?
Mm-hmm.
They care about, speed. How quickly can we fill the role? Because speed is very strongly correlated with the nurse's experience. It's just, you can see even within the small section of HR, you can see that they're caring more.
Mm-hmm. Yeah. And that's really what needs to happen, because I don't think any worker needs to feel like a commodity on a conveyor belt, but especially when we're doing something that is so high stress already and is so easy to say, this is bad, I'm done. So until we like make these conditions much better for nurses, if we do improve these conditions and we get nurses in the jobs that they want, in the places they want to be, um, there's just no other way to put it. It makes for better care. It just
Yeah.
does, at the
Yes.
bottom line.
Yes.
And I know that nurses also, there are even websites I've gone to looking at jobs in other parts of the country. And you look at some of these nursing positions, they don't list salary, they don't list schedule. It almost feels like you're applying for, you're not even sure. I think it's a job I'd like. I don't know what the hours are. Haven't talked to them about salary. And even though there's some negotiation that occurs between employers and nurses, it's nice when all of that information is provided up front
Yeah.
so that you know what you're getting into.
Exactly. And it's funny. It's funny you say that because the employers have the same concerns on their end. Not every nurse resume is perfect, right?
Right,
And so
right,
they're missing a bunch of information. They're not really sure about the. So yeah,
right.
there's definitely room for improvement on both sides.
And when you kind of standardize that communication through a system like this,
Yeah.
and then of course you have whatever algorithm you use to match, and that you said that your co-creator of Incredible Health is actually an MIT grad. Is that what you said?
Yeah, yeah. My co-founder is software engineer. Yeah, I went to MIT. He's been building software for the last
It's
15
like the perfect marriage of skill. It's like professional heaven, that you've got
years.
this
Yeah,
need that you see in your profession, and then this person who's able to literally create the thing that brings
exactly.
this to
And
life.
I mean, we don't employ any recruiters. We employ software engineers. We have some
Hmm.
marketers, but like we don't operate like a traditional recruiting agency at all. Like
It's like
this
a
is
self-driving
a
machine.
software. Yeah, exactly. This is a
And then
software.
you also don't have to worry about, I know a lot of people say that one of the biggest complaints about travel nursing companies is that when you have recruiters, and I know there are wonderful recruiters out there are many people that speak highly, but there's commission there. And so the question is always at the back of your mind, even if they're a good recruiter and they're transparent and they're friendly, the question is always, are they trying to get me in this job because they're getting a commission, or are they trying to get me in this job because this is the job that I belong in?
Yeah, I
Um,
love that you brought that up. Actually, it's our platform is always free for nurses. Everything's free. The hiring product, the CEUs, everything's always free for nurses. It's we make our money from the employers, and the employers are paying for the software. So they are not. And the other thing that we keep our team accountable to is something called the Net Promoter Score. So what is the experience of all the nurses on our platform, or the employers on our platform, and we're measured against that. So we're not measured against, okay, how many people did we place? Like, we care about the customer experience.
so quality over quantity,
Exactly.
which I think is a great way to be.
Yeah.
I think that as the demand increases, and as one of the reasons I wanted to have you on the show is because I want every episode to kind of bring my audience things that they can actually do, actionable steps, real things that they can do to improve their careers, the quality of their lives. And this was something that I thought immediately was a perfect fit when I first heard about this company. I'm excited that you're here talking to me, because so many people email me and they're like, I don't know what to do. I don't know where to apply. I would move, but I'm not sure where to look. And there are just so many factors that come into this. And so I think that a lot of nurses who would otherwise feel completely overwhelmed and maybe not try, just stay where they are, try to make it work, might feel more empowered to know that this is something that's getting easier to do instead of harder.
Exactly.
That
Yeah.
you don't have to worry about, I've even heard people say like, oh, well, to get hired by a hospital, you have to use keywords in the job ad in your resume to trip the system
Yeah.
that looks for keywords that will get you into a pile that will eventually get to someone who might call you.
Yeah.
And that's real. I'm not exaggerating.
You're
There are
right.
all these
It is real.
layers that make it just so much more frustrating.
Yeah. I mean, at the end of the day, like we believe that, even though the talent is out there, the opportunities are hard to find, and we're here to really democratize opportunity.
Yeah.
To find a job that's a great fit for you, you should not have to, deal with keywords. You should not have to get a friend to refer you. You shouldn't have to, be fully aware of every single employer in a particular city. Like all of that can just be taken care of on your behalf, and it should be.
Which is really nice. Do you foresee something like this for well, I don't know if you can talk about this. I know that you probably have goals and dreams, but expanding the territory that you guys cover, the health systems that you include, is
Yeah,
that
absolutely. So we have plans to expand geographically and cover the entire country
Mhm.
instead of just 5 or 6 states. Uh,
Sure.
we have plans to expand to more roles. So right now we do RNs and NPs.
Hmm.
So we do plan to add other professions which are also in high demand.
Yes, indeed.
And then we are also expanding the types of employers that we work with. So right now it's very focused on hospitals and health
Hmm.
systems, but we are in early talks with other types of providers too, because healthcare is huge, right? Like there's surgical centers and urgent care and telemedicine providers, and
There's so much. Hmm.
and all of whom suffer from the shortage too.
Absolutely. And all of whom would like to make this easier instead of harder. So
So the other thing that we're going to keep doing is providing free tools and services to nurses.
absolutely. And the CEUs alone are reason enough. So as you decided to roll out these CEUs, I'm sure you sourced. I mean, where does this information come from? I don't know. I'm a new enough nurse that I don't know where these CEUs come from. I know a lot are created by NPs and different organizations and physicians.
Yeah.
Are you guys creating this content, or are
Yeah.
you?
So all of our CEU courses are created by nurses, and
Mhm.
they're all fully accredited by the ANCC in all 50 states, right?
Fantastic.
So what that means is that you can guarantee that the courses are going to be useful, applicable at the bedside, and you have a pretty wide range of over 100 to pick
Yeah.
from,
I'm
and
looking at the
the
dashboard right
library is
now.
constantly getting updated too.
Yeah, and there's so much, and it'll actually track your hours that you've completed. Is that what I'm seeing?
Exactly. So when you first sign up and you enter even just like your license, like the state you have a
Hmm.
license in, it will automatically tell you how many contact hours you need to renew and so on, right?
Nice.
And
Yeah.
then it will also track the hours you get, and then the certificates are immediately available for download as soon as you complete them. And in some cases, we use CE Broker, where we are automatically able to send that certification to the relevant state license
Oh,
board
nice.
for specific states.
Yeah, this is great. I'm looking at it now, and it tells you, and it tells you how many contact hours you get. You're able to see the different accreditation. But yeah, the list is really long. This is pretty fantastic.
Yeah,
And that's that alone. But yeah, it's very easy to navigate, and there's a community as well. There's like community feed, and I was just scrolling through looking at some, it's like a message board, and there's some really great information about gosh, anything you can think of, license renewal, avoiding burnout, salaries, interview advice. It's a really robust community. I mean, I'm just casually scrolling through.
yeah,
There's tons of information here from nurses.
that's right. And that's a feature that will continue. It's actually in beta. You're in our beta right now,
Oh, nice.
so it hasn't
Yeah.
even fully publicly launched yet. But
Well, if this is beta, I
we'll
can't
come,
wait.
exactly, I'll come back. I'll come back in a few weeks to talk about the nurse network and community that we're building.
Yeah, but I mean, even just the beginnings of this is really great. This does not look like a beta version. So,
Yeah,
um, but yeah, and I know that one of the reasons people listen to this show is because they're always just seeking out information about things they might not have even realized were a thing.
yeah,
And prior to digging around and learning more about incredible health, I didn't know this was a thing. And so, on behalf of nurses everywhere, I have to say thank you for like making this kind of the new way of doing things, because I really think that it's just a matter of time before this becomes the norm.
Yeah,
Or at least I hope, because
me
as
too.
an, you know, we have all these incredibly talented, highly skilled medical professionals, you know, from physicians, PAs, MAs, respiratory therapists. And so I think that would be a fantastic goal, would be to get everybody in on the party, because this
Yeah,
seems like
absolutely.
that there are a lot of people that are going to, I know, are going to want to sign up for this. I
Yeah.
also know, where do you stand with like brand new nurses, graduate nurses? I know we have a lot of students that listen to the show. How do
Yep.
employers generally receive those newbies coming out into the field?
Yeah, so for new nurses, you can certainly use our CEU product and the
Hmm.
community that you mentioned there. Unfortunately, on the hiring piece, a lot of our employers require at least 1 year of acute care
Hmm.
experience. So once you have that 1 year under your belt, then you can become very active on the
Yeah.
platform, very employable. But yeah, unfortunately, it's because the employers they aren't
I,
all well set up for training new grads.
And I
And
don't think that that's necessarily an unfortunate thing. I think it's nice to know that coming into it.
yeah,
But I think that there are so many nurses that I've known that I still think that as a nurse in your second year, I still think you're kind of a new grad, very
yeah,
much so. You're still learning. And so maybe not super fresh out of school, but this does sound like an opportunity that once you've got that year, you've got that solid foundation.
yeah,
But I think that that would be the case moving to a large hospital system anyway. They
yeah.
can be very large and intimidating to navigate. So
That's right.
having your foot in the door can help quite a lot, I
It
imagine.
can. So what we usually advise, we still do have a lot of new grads that sign up on our platform.
Hmm.
What we advise them is try to be geographic with that first job out of school. Try to be geographically flexible. Just try to be flexible.
Hmm.
And all you need to do is just get that first year of experience under your belt, and then you will become highly sought after. Right. So it's just getting that first year, and that's, by the way,
Hmm.
this is across industries. It's not unique to nursing.
Of course, of
you know
course.
so like any new graduate just needs to get a little bit of experience under their belt, and then they become very enjoyable.
Really shine for the first year, get as much experience as possible.
Yeah,
A year in the life of a nurse is a lot of things. And so there's a lot of growth that occurs in that first year. So
yeah,
um still, I think that you're saying, what you're saying is very valid. New grads can still sign up for this, and cruise the site for information, CEUs, the community. I can't wait to see this once it's out of beta, because
yeah.
it's pretty
I'll come
cool.
back and talk about it.
Yeah, that'd be awesome. I
Why
already
why we
have
built it and everything. Yeah,
I have my profile set up. I even picked a bunch of cities that, someday might be nice.
yeah,
But yeah, this is really fantastic. It allows you, I haven't put any of my professional references in there yet,
yeah,
but otherwise I was like, ooh, I get to fill things out. There's something I think about people in my generation and younger, that they see an app and they're like, oh yeah, I'll make a profile. I don't know what it is. I'll make a profile. I'll put a photo
yeah,
up there.
yeah.
But that adds to it being enjoyable, I think.
It does. Yeah, it's your
All kidding
online.
aside.
It's like an online identity, right? It's a
Yeah.
professional identity. Yeah,
And I think that it also is incentive to think about what's out there, because while I might not be, I keep saying I'm not looking, but my career is long. And so when my partner graduates from grad school, we might start looking at other places out of state. And so I
yeah,
just like to have all the options,
yeah. I mean, I'll
at my
share a stat
fingertips.
with you. Usually, at any given time, 30% of nurses in this country are looking.
Yeah. Hmm.
It's a big. It's a big chunk.
And it's not all because of dissatisfaction.
No, not at all.
It's because we want to see more and do more, and
Advance your
advanced
career.
degrees, exactly,
Exactly.
advance your career,
Get more
and
skills.
mhm.
Yeah. Absolutely.
um yeah. Well, this is actually really fun. I would love to have you come back and talk about this in the future. This was still a very new bit of technology for me, but as I have time to like actually look around and use some of the CEU options, I'm not in a crunch to get my CEs done, but they're already topics that I'm really
Yeah,
interested
you can
in.
imagine there's probably, I don't know, 10-15% of nurses that are in a crunch right now.
Yeah, I'm sure. But
Yeah,
that's why this is nice because it's all in one place and you don't have to worry about, is this accredited? Is this not? Is this going
yeah,
to help me? So I mean I'm looking I should be looking at you, but I keep looking at my phone because it's just really interesting
yeah,
to see how it's all set up. It's really it's attractive, user friendly, all the things you want in a really nice platform. So
absolutely. Yeah.
what else would you like people to know about Incredible Health and the work that you do?
Um, I think I think I've covered most of it. I mean,
I'm putting you
honestly,
on the spot here. Yeah, I
it's
mean,
honestly the most important thing is the mission, right? Is
mhm,
to help healthcare professionals live better lives and help them find and do their best work. And all of our decisions and all of our efforts stem from that. And this is a group of workers that needs to be better appreciated, that needs to not get overworked, that just needs to just overall have a better life and work experience.
absolutely.
And we're committed to that. We're committed to that for multiple decades if that's what it takes. And we just want to make sure we're there to support nurses.
Well, I want to thank you on behalf of the nursing profession because I think this is a really great thing, a great tool, and I hope a lot of people that are listening to this take advantage of it.
Yeah,
Um,
I love working with nurses. A lot of my team members are nurses too.
You
Yeah,
know, that's just it. It's a collaborative approach to healthcare. We need to all work together to empower each other, to improve the quality of our professions, and to really do this all in the name of our patients.
yep,
And as nurses, we're patients too. We want a strong healthcare system for ourselves and our families, as well as for our patients.
yep,
So, uh,
exactly. So yeah, if anyone who's listening is interested, you can just check us out at incrediblehealth.com.
fantastic. Super fantastic website. I appreciate your time so much.
Yeah,
I would
thank you
love to
for
have you
having me.
back anytime. Absolutely. And for those that are listening, in addition to going to incrediblehealth.com, you can also check out nursinguncensored.com for other episodes, blog posts, vlogs, all sorts of things like that. Again, I want to thank Dr. Iman Abuzeid for being with us today. And again, thank you so much for your contributions, and I look forward to talking to you again in the future.
Yeah, sounds great. Thank you so much for your time.
Excellent. Yes, thank you. And happy nursing, everyone. Here at Nursing Uncensored, we may be, well, uncensored, but we're not unfiltered. Protected health information has been changed and concealed to comply with HIPAA. The things we talk about are from years of experience with thousands of patients, things we've read, stories we've heard. If you think we're talking about you, we're not. Also, we're real nurses here to provide helpful and accurate information, but don't take anything we say as fact without doing your own research. Refer to your state's Board of Nursing, Practice Acts, and your institution's policies and procedures if you have questions about your practice. Lastly, our very strong opinions are ours alone and do not reflect those of our employers, educational, or professional institutions. Thanks for listening, and happy nursing, folks.